Welcome back again. Now I want to talk about an exercise that you're going to be doing at home. It's part of a spinal rehab program. It's the spinal fulcrum exercises. The fulcrum helps reestablish the curves, the normal curves back into your spine. These curves are really important. See, you have three curves to your spine. One in your neck like this, one in your mid-back, one in your lower back like this. This is a side view of the spine. So in the neck, mid-back, and lower back. In order to correct chronic neck pain, chronic lower back pain, disc problems in your neck, your lower back, we have to, folks, reestablish those curves. Even the decompression table that we use helps increase the circulation, the blood supply, and to the joints, ligaments, tendons, the muscles, helps open up the spine. But we have to get those curves back in order to correct the problem. So this is a very important part of the rehabilitative process. So with the neck, if there's been old injuries to the neck, like a whiplash injury, injury or fall to neck or head area, some patients that come in, they've actually lost some of the curve. The curve has gone actually straight in some cases, and in some patients the spine's actually reversed. We have a reverse curve to the neck. And what this is doing, folks, is it's putting tremendous stress and strain on the neck and upper back area when you start to lose the curve and the head starts to shift forward like this. For every inch that the head shifts forward like this, the weight of your head doubles. Your head weighs about 10 or 12 pounds or so. For every inch that the head shifts forward, again, it doubles. So if it goes forward like this, now you're carrying with the head, now the head's weighing about 20 pounds or 20 plus pounds. That's why it causes tremendous stress and strain to the neck, upper back area, causes the spine to shift, muscles will spasm, these nerves become pinched and irritated, and also the discs right here, they become compressed because the weight is shifted forward. There's no curve to your spine there to have the weight distributed along the spine, compresses the spine, leaves you susceptible to disc injuries and disc problems. Okay. Now the same thing with the lower back. You have to have that curve in your lower back. In patients that have chronic lower back pain or disc injuries, even spinal stenosis, a lot of them have lost the curve to their lower back. Their spine's completely straight like this, right? Sometimes, again, even reverse, where the spine's reversed forward like this in the lower back. Folks, when you're sitting, it causes 50% more pressure to your spine when you're sitting compared to lying down. And when you're standing, it's about 35 more increased percentage when you're standing versus lying down. So this is very important that we get these curves back into your spine here like this. Again, when you lose the curve in the lower back, that compresses the spine. All the weight is distributed down through here. It's compressing the lower back, and when that's there long enough, all it takes is a simple bending, twisting, picking up something, boom, your back goes out. Your back goes out, and you can cause a disc problem like this. Here's a disc herniation, classic example of the spine herniating out. The disc is herniating out because the normal biomechanics have to be restored. They have to be corrected there. So it's very important that we reestablish the curves in the neck and the lower back. And what we do is we have these fulcrum exercises we have patients do at home, and Rebecca's going to demonstrate these. Go ahead and face this way, Rebecca. You have one for the neck, the other way. One for the neck, one for the lower back. This fulcrum exercise, this one's for the neck, the lower back. Hold that there. Lay back on it. And this one's for the neck. This goes down here and lets the head and neck traction over the fulcrum. Legs are bent like this. You can see, put your arms down for a sec. You can see a lower back fulcrum here, neck fulcrum, the head's hanging over that area. We're reestablishing the curve in the lower back, reestablishing the curve in the neck there. Again, this is something that we do. It's a ligament stretching exercise. It's opening up the spine, relieving the pain, relieving the pressure off the nerves and the discs, and getting those curves that come back in the spine, both the lower back and neck. This is something you do at home, and there's exercises that you do on these fulcrum pieces here after you get to about 10 minutes of lying on these comfortably. Okay? So again, it's a home rehab part of our spinal rejuvenation program. Very important that you do in order to get better.